Hi, my name is Haley Oliver, and I'm a professor of food science in the College of Agriculture at Purdue University and the director of the USAID Feed the Future Food Safety Innovation Lab. And we're so glad that you've joined us for our second webinar in our series on risk-based approaches. I'd like to call your attention to some of the features of our webinar. You'll notice at the bottom that we have a closed captioning option should you need it. And we highly encourage you to add your question to the Q&A function, which should be available throughout the presentation. We're also sharing links to the slides for both presentations in the chat. Should you have any trouble viewing the presentations today, we invite you to use those links so that you can open the slides on your own computer. We will also email the recording and presentation to all attendees in the next week or so. So again, today we're going to be hearing from the field, from individuals that are putting risk assessment into practice. And thank you for joining us for our second of our two webinars on risk-based approaches. Last week we were introduced to risk-based approaches as a data-driven, transparent process to identify, assess, prioritize, and manage food safety risks. We heard how risk assessment is quite adaptable and scalable, from guiding national efforts to reduce salmonella in poultry products to addressing specific risks in a single food business or single value chain. It's clear that they are valuable tools that have helped food safety authorities, private businesses, NGOs, and other stakeholders around the world create roadmaps for strengthening food safety practices and policies. This week, we have invited two researchers to share case studies on how risk-based approaches have been applied in Latin America and Asia. It's my absolute pleasure to introduce Dr. Fernando Sampedro. Dr. Sampedro holds a PhD in food science and technology from the Polytechnic University of Valencia in Spain and has 15 years of extensive research, training, and country technical assistance experience in the areas of risk assessment and risk prioritization, risk-based food inspection and surveillance, and risk communication. Dr. Sampedro has been an international consultant for FAO, Pan American Health Organization, Inter-American Institute for Cooperation in Agriculture, and the International Atomic Energy Agency in implementing national risk-based food inspection and surveillance programs. He is currently coordinating a World Trade Organization-funded international network in food safety risk analysis for Latin America. Welcome, Fernando.
Thank you for the invitation, for giving today's talk about my experience implementing risk-based inspection models and surveillance in Latin America. I want to thank the Innovation Lab for Food Safety from the University of Purdue for the invitation. So let's see what is the outline of today's presentation. I'm wanting to talk about what I've seen working with different countries in Latin America. What are the current food safety challenges that they face? What are the methodology and the basics of a risk-based inspection model? And finally, I will be presenting some examples from several countries in Latin America and how they have implemented this risk-based approach, risk-based food inspection model. This is the biggest dilemma that most of the regulatory agencies have worldwide, is how we can assure protection of public health with the available resources that we have for inspection, for surveillance, right? This is really a headache for most of the agencies because we live in an environment where we are facing tighter budgets, we are facing limited resources, and less inspectors, less sometimes even vehicles to do the inspections. But what we wanted to make sure is that with the available resources that we have, we'll be able to protect public health. What are the current challenges that I've seen in the region? A huge increase in small food enterprises, most of them family-owned, and most of them making cheese. It seems that the artisanal cheese in Latin America has exploded during the last 10 years, and you have seen a lot of small-scale cheese-making enterprises, small, popping up everywhere in Latin America, which creates a really huge challenge for the regulatory agencies to inspect those small enterprises. Tight budgets, we have already talked about this, with the COVID-19, all the pandemia, we have seen that the economy is getting harder and harder in terms of resources for public agencies. And of course, inspection and surveillance is one of them that has been suffering. When I visit laboratories from the regulatory agencies, like official laboratories, sometimes they are pretty old, the techniques are not up to date, and actually sometimes they are also at full capacity. So for gathering data in terms of baseline studies on pathogens, prevalence, or chemical residues, most of the countries are struggling, right, to collect enough samples to be statistically significant, right, and make inference from that data. We have seen also lack of systems harmonization. So it seems that every country is going its own way for implementing inspection and surveillance systems. So also that will related to lack of trust, right? Some of the countries are able to export, like I don't know, Honduras, Costa Rica. We have seen a lot of different examples where they're able to export to the US, European Union, but then they are putting more barriers to their own neighbors. So I've seen a lot of lack of trust between neighbors and countries instead of risk-based inspection. What are the current information gaps that are also seen in the countries in Latin America? We know that, as we're saying, there's limited surveillance in terms of pathogens, prevalence, chemical residues. Sometimes they have official programs, but it's focused only on limited food products. Huge underreporting, we already know this. Most of the countries report diarrheal diseases, but actually the agent or the pathogen causing that disease and actually the food source, it's very, very limited. And lastly, one thing that is very important for chemical exposure is the consumption, right? And we have seen that there is a lack of comprehensive national consumption surveys. And where we can find some consumption surveys that are very old, like sometimes 20 years old, which won't represent the current consumption habits of the population. Okay, what is risk-based inspection? What I tell countries is you want to implement a risk-based inspection to adjust the frequency and type of inspection based on the risk level. If a country wants to implement a risk-based inspection for domestic production, there are two dimensions that they need to evaluate. What is the inherent risk of the food category that the establishment is producing, and we can use different tools to assess that risk. And then the establishment risk. There are certain factors that will measure the performance, the food safety performance of the establishment risk. So combination of those, food and establishment, will make this risk-based inspection program. Also, we can implement a risk-based inspection program for import-export, right? And we'll have different dimensions there. What is the risk of the food category that we're importing in our country, the tariff heading usually? What is the risk of the importing country? And we can look for databases, the FDA database for importing commodities. We can look at the RASP, the European Union database. We can look also InfoSan from the World Health Organization on international alerts in food safety. And finally, we can look at the performance of the importer. And we combine those three dimensions, we can estimate the risk and implement the risk-based inspection program for import-export. What are the goals? What I tell countries? Why you want to implement this? Well, optimize resources. That's the main goal, right? How I can align the resources that I have in terms of the number of inspectors, number of vehicles, time that I can allocate to inspections, to the establishments that have the highest risk. We also want to improve the compliance of the establishment, right? If I take like a snapshot of the current food safety status of the establishment that I'm inspecting, I can start seeing trends. I can implement strategic goals for those establishments to improve their compliance. I can also harmonize the inspection models in the region. So if your model is equivalent to my model, right, I can start to start thinking about equivalency, start thinking of free trade agreements, it facilitates regional trade. That's also what we want to accomplish. And finally, what we want to see also is a reduction of the foodborne diseases incidents in the country. What tool we want to implement at the end? What type of platform, what type of tool? It's a risk algorithm, right? A risk algorithm that is able to assign a risk level to each importation or to each establishment, right? And usually most of the countries have this traffic light, green, yellow, and red in terms of the risk level. And we want this risk algorithm to be dynamic. Every time I do an inspection on an establishment, every time I do an inspection and importation, the results of the inspection will be uploaded to a cloud-based platform that the country has, and then the algorithm will reassign, reevaluate the risk according to that inspection, but also according to new alerts, recalls, also the labs, right? The regulatory labs, the official labs, sending the results of that sampling into the risk algorithm. Okay, so we try to create a manual for countries in order to create a methodology, a stepwise methodology. What are the different steps that a country needs to follow to implement a risk-based inspection? So I work with the Pan American Health Organization to the regional office in Rio de Janeiro in Brazil. And this manual will be published this year on risk-based food inspection for food producing establishments. So let's look at what steps we're trying to highlight in that manual. What I tell countries when they try to implement a risk-based inspection program is establish the scope, right? We don't want to implement this in all the food chains that the country or the regulatory agency needs to inspect. Usually, what I tell them, it's that you just start with 1 or 2 priority food chains, and priority means the one that is more exported, the one that has the highest contribution to the economy of the country, right? And also the important thing is what type of facilities we want to include in this risk-based inspection model. We have 2 different ways to do it, but volume of production, if you are lower than a certain volume, this risk-based inspection model won't apply to you, or by the number of employees. So establishing the scope is really, really important for a country that is starting with risk-based inspection program. Then the second step is collect all the information, right? What is the registration of the companies, the location? What are the type of foods that establishment commercialize? What is the annual production? And surprisingly, this annual production, it's sometimes really hard to collect in the different food establishments. Sometimes there is no formal way to collect that information, or there are significant gaps in that specific information. And remember, the higher the production volume, the higher the potential impact on public health if something is going wrong, right? The history of inspections and non-compliance, we want to keep a record on the previous years' non-compliances and the history of inspections. The scope of commercialization, right? If it's local, national, or if the company is exporting to different countries. And then lately, one specific thing that most of the countries are thinking now how to include in a risk-based inspection model is how to include these private schemes, right? If a company is certified, but a certain third-party scheme, how that can be included? Is that lowering the risk? Is that something that we can reward the companies? What type of equivalency systems we can put in place to say this private scheme is equivalent to my inspection? Then the third step is collecting information about the specific food categories, right? And one of the things that I ask the countries is, do you have an official food category list that is shared between agriculture, the Ministry of Agriculture and the Ministry of Health? Sometimes we don't have a standardized list of food categories. We don't know how to define the different cheeses that are produced in the country. We don't have a regional approach on how to define those food products. And sometimes the Ministry of Agriculture is using one specific categories, and the Ministry of Health are using different types of categories. So that's important to harmonize that food category list. Foodborne diseases, outbreaks, we want to collect that information, specific hazards that we have found, identified in different food products, market recalls, international alerts, and finally, as I was mentioning earlier, the per capita consumption. We can get some FAO food balance data for most of the countries, but when we want to look at specific products, sometimes we don't have any information on what is the current consumption. This is just an example of how countries are grouping the different products. This is for dairy categories. So when we try to evaluate the risk, we evaluate the risk for each group individually. That I will include all the food items or food products into that group. So as I was saying, for a domestic risk-based inspection model, we'll try to categorize the risk of the food product that is being manufactured, and then we'll try to categorize the risk of the establishment, what is the performance in food safety, and we'll combine both risks to estimate the total risk. In order to do that, and I'm sure that you already have seen from previous presentations some of the risk ranking tools, we have decision trees, we have risk matrices, and we have the multi-criteria decision analysis. So I've used these tools with countries to categorize the risk of the food products and categorize the risk of establishments. Let's see some examples. Decision trees. This is a very versatile tool where you can start to evaluate in a high number of food products. It's a qualitative tool. It's used when we have limited data, which is common for most of the countries in Latin America. And the good thing is that we can filter out, based on the production of that specific food product, the low-risk food categories. So let's see some examples that we have used with countries in applying decision trees. For example, this is a decision tree I've used with different countries, where you start to ask how the food is being produced. And we can ask about, is there any lethal treatments that will reduce the pathogens to an acceptable level? Is there a potential for cross-contamination? There is potential for growth during shelf life. Is the consumer cooking or not cooking the product reaching an internal temperature of 70 Celsius? Those things, when you answer those questions, will start to categorize the food products into low, medium, or high risk. We can do this for biological hazards and see an example for chemical hazards. In here, we want to ask if the raw materials are susceptible to have chemical residues above the residue limits. And we want to look at the official surveillance program by the country. And then we want to look at if there is any routine testing done by industry, for example, antibiotic residues in milk, that will reduce the likelihood for the chemical residue to reach the consumer. Is there any process then that could be introducing the chemical, like chemicals that are produced during production, allergens, packaging, something like that? And finally, what is the consumer doing with the product? If washing is reducing the chemical, for example, pesticides that are hydrosoluble, maybe could be reduced by washing, or if there is anything that could potentially reduce the risk. And we do the same thing. We categorize the chemical risk at low, medium, or high. So with that, with the decision tree, the countries have been able to categorize the risk of every food category. Then we have used this multifactorial risk matrix for establishments, right? And I tell countries, okay, let's define what risk factors you want to evaluate in each establishment to measure the performance in food safety. We agree on a specific scoring system that the country is more comfortable with. Then we ask the inspectors to assign a specific relative weight for each factor. What is the contribution of that factor to the overall food safety risk? And finally, we combine the factors and the relative weights to calculate the level of risk for each establishment. This is an example of a list of that countries have come up to measure the performance of food safety. We can see degree of regulatory compliance through checklists, GMPs or HACCP, volume of production, scope of marketing, target population, plan layout, number of non-conforming samples. We have an allergen control, a huge list of factors that I can evaluate in each establishment. Then for each of the factors, we assign a risk scoring system, in this case between 1 and 7 points, and then assign a relative weight for each of the factors. These relative weights doesn't sum up to 100 because I cut the table, but it will sum up to 100%. And then I multiply each of the weights by the scoring system and assign a final risk score for the establishment. Then what I tell countries is we need to work also on the checklist, the GMPs checklist and the HACCP checklist. Most of the countries have qualitative checklists, so we're not able to assign the scores to the inspections. So this is an example of a checklist that we work with Honduras with the different requirements for GMPs, and we have a compliance score, 50%, 100%, or 0%. We assign a value and then a category. If it was a major minor, or critical scoring. And then finally, we'll assign a percentage of compliance that we can include in the risk matrix to categorize the compliance of each establishment according to GMPs or HACCP. This is the overall look at the model. We have used a decision tree to categorize the risk of the food categories, assign a scoring system for the product risk. We have a multi-criteria decision matrix for the food establishment, assign a final score for the establishment, and then we combine both scores to get the inspection frequency, to get the final score, and finally the country will decide on the inspection frequency. So with the risk scores, the less risk, the less frequency of inspection, the higher the risk, the higher frequency of inspection. This is an example that we can do annual every 9 months, 6 months, or 3 months, depending on the range of the scoring system where the establishment falls in. But this frequency of inspection, each country needs to assign those frequencies. And what I tell countries is the most important thing is you comply with your annual inspection program. That's the most important part of it. But with this, we can optimize resources, right? We can focus on the establishment that have the highest risk and then kind of reward the establishment that have a better performance, inspecting them less frequency. Of course, as any plan, we need to revise, adjust, and communicate. The communication part is very important. We want to make sure that the industry in the country knows how we're evaluating each establishment, what are the rules of the game, and we encourage them to improve their performance with time. So also the country can do strategic goals. They can say, okay, this is the first snapshot, first picture of what is the performance of the establishments in my country, what is the percentage of high risk, medium, and low risk. And from now till in 3 years, I want to decrease the high risk and the medium risk and increase the number of low risk establishments, right? So this is a great tool also for the country to measure on specific goals for the future. This is just a slide showing that we can apply the same methodology that I've explained in today's talk for import-export. In this case, we'll have different dimensions, as we were talking before. We can apply the same scoring system, weighting factors, and apply a final risk scoring system to assign frequency of inspection for importations, and then the type of inspection. So again, we can apply this same methodology for import-export. Let's, for the final part of this presentation, let's talk about different examples from countries. I've been working with SENASA in Honduras for the last 4 years, and they really, for me, is the country that has implemented the most this risk-based approach and risk-based inspection. So currently, they have implemented risk-based inspection models for all the ready-to-eat and dairy establishments in the country. Fresh produce, shrimp, and dairy farms, they're able to adjust the frequency of inspection and the type of inspection according to the risk level. They revise the plan every year, gathering the new data, and they have been able to optimize their inspection resources. They also have applied the inspection model for third-party laboratories, when to inspect a laboratory, how to create a risk scoring system for laboratories. They have also applied the concept of risk-based surveillance to foodborne pathogens and veterinary drugs, right? How many samples to collect in one specific pathogens and in one specific food products. And also, they are now incorporating the use of third-party schemes like GFSI or other third-party schemes into the inspection models. I was mentioning earlier how the risk-based inspection can capture the companies that are already certified for certain schemes. Same thing with Costa Rica. I've been working with them for the last 4 or 5 years. They have also implemented a risk-based inspection models for ready-to-eat meat, dairy, and seafood establishments. They have been very strong in risk-based surveillance. They have surveillance programs for veterinary drugs, heavy metals, additives, and pesticides in fresh produce, looking again at the risk scoring. They have established different risk scoring, right, to categorize the toxicity and the exposure levels of different chemical residues. and assign the number of samples per year to do in every chemical and every food product. Lastly, they have an excellent online inspection platform that includes a risk algorithm. So every time inspector goes to a food establishment and do an inspection, automatically that's uploaded to an online platform, and it will tell the inspector when the next inspection will occur, because the risk algorithm will recalculate the risk and will assign the new frequency of inspection. Work in progress. I'm currently working also with Guatemala, the Ministry of Health and the Ministry of Agriculture in ready-to-eat meat products and dairy facilities, dairy farms, and with the Dominican Republic in another risk-based inspection model for dairy facilities. So this is great, right? I mean, most of the countries that are moving into a risk-based approaches, and hopefully for future work in Latin America, what we want to do in the next coming years is increase the harmonization and hopefully the equivalency, right? If we can establish certain equivalency systems, like for example, the inspection model from Honduras is equivalent to Costa Rica, so we don't need to inspect each other all the time, and we can have some sanitary trade agreements because our models are equivalent. Increase trust, this is huge, right? If I trust my neighbor, I can increase the trade with my neighbor, and we can have much more work together. Establish strategic goals aligned to public health metrics, right? That is lacking in most of the countries. We know the performance of establishments. We know that we're trying to improve food safety, how we can align that to public health metrics. Finally, also, we want to increase the funding for doing consumption surveys, national consumption surveys, total dietary studies, and baseline studies, especially for pathogens. We're lacking data on the prevalence of pathogens in different food products. Finally, I want to really thank all the supporting agencies that have worked in different projects with different countries. Without their support, I won't be able to present all this great work that I've done with the countries. So thank you again for the agencies to support the work. And if you have any questions, I will be happy to answer them.
Thank you, Fernando, and I really appreciate you drawing attention to that risk-based approaches are both for domestic and import-export scenarios. And I also appreciate that you drew attention to efficiency and impact. It doesn't matter what the size or scale of the economy, we will have limited resources, and how to best invest those to improve food safety really is key, and this is one of the foundational tools or approaches to being able to do that. It's my pleasure to introduce our next guest, Dr. Hung Nguyen, who is the co-leader of the Animal and Human Health Program at the International Livestock Research Institute and the lead of the CGIAR Initiative on One Health. His current research focuses on the link between health and agriculture, food safety, infectious and zoonotic diseases, with an emphasis on the use of risk assessment for integrated food safety management. He was the ILRI regional representative for East and Southeast Asia, the flagship leader of the food safety of the CGIAR research program on agriculture for nutrition and health, the A4NH program, and the chair of the working group integrating a One Health approach to COVID-19 response at the CGIAR COVID-19 hub. He has experience working in Asia, Africa, and Europe, and holds a PhD in life and environmental sciences from France. Welcome, Dr. Nguyen.
Thank you very much, colleagues. Good morning, good afternoon, good evening, participants. It is my big pleasure to be here today to attend to this webinar in the spirit of celebrating the World Food Safety Day. Actually, we celebrated a few days ago, but I understand that is a whole month that we celebrate. And let me share the screen so that I can share with you some experience of our research at global level. And here today, I focus on the context of Asia. Can you confirm if you hear me okay and see the full screen? You do, I suppose? Okay, so let me go ahead. Okay, so in the next 20 minutes or so, I will share with you the experience linked to some case study from Asia, how food safety risk assessment is used in particular in the context of prioritization for our study and intervention in Asia. And I am very happy to listen to my colleague Fernando, because Fernando together with me in Southeast Asia, when I was there, we ran a course on risk assessment for Southeast Asia, One Health University Network, and some of the slides you talked about South America apply very well also in the context of Southeast Asia. And I'm talking on behalf also of my colleague Sinh Dang, a postdoc from INRI, Vietnam, but also my colleague Delia Grace, who is now at NI in the UK. I think that as for the past days of the week, we talked a lot about the context of foodborne diseases. Just a short reminder to you, that is the big issue on global health, because here the data is a bit old, but it reflects that the burden of foodborne diseases is equivalent to the big three infectious diseases we are talking now. That is about HIV/AIDS, malaria, and tuberculosis. Whereas investment in controlling or dealing with foodborne diseases is not proportionally with the level of the burden it's causing. And also, that is about public health. But in terms of economic loss, it causes a loss of something like more than $100 billion a year at global level. Unfortunately, most of that, I would say 95%, is in developing countries. So that is actually the context we are working here. You can see in low and middle income countries, most of the food are actually traded, bought, and consumed from the so-called informal market or traditional markets, or sometimes it's been called wet market for some of the country, in particular Southeast Asia. Here it gives you an idea about how it works. For example, here I take example of pork value chains. Sorry if these pictures might be sensitive to some of you, but it's really most of the pork is being produced by the so-called smallholder livestock production systems. It goes to the second pictures. Most of the case slaughterhouse on the ground, so the condition of hygiene and infrastructure is not great, so a lot of contamination happening at that level, including also how people transport pork from the slaughterhouse to the market. You can see here, most of the case, motorbike are useful for those who have visited Southeast Asia, in particular my home country, Vietnam. And it goes to the traditional market in the photo here on pork, but also apply for vegetables, for example. So the context of food safety is very challenging in this context because of the hygiene condition, because of poor investment in infrastructure, etc. And it represents actually 90 or 95% of food people take from this context. So the question is, in fact, in this challenging context, how do you work? What are the approach? What are the solutions to food safety in low and middle income countries? And of course, Fernando's already talked about risk-based approach. And actually, it's an approach that we at International Livestock Research Institute, together with our partners, is really to go through these 4 points I listed here in this slide. First, you need to understand the evidence of risk, like we mentioned before, how many people got sick, what level of contamination. But assessment is not enough. You need to develop solutions that should be practical and socially accepted in this context. This innovation need to help to solve this problem by mitigating, or in the best case, eliminating this risk of food safety in traditional market. So the focus of international market, informal market, like I said, and of course, when we work, the consideration of gender, nutrition, animal welfare need to be taken into account in the risk analysis framework. And of course, I will focus more now on the assessment, but also the management of things. So the work we are presenting today is really part of our food safety research portfolio at INRI and partners. Delia actually initiated this program 15 years ago, and I had the pleasure to take over from her for the since 3 years. And that is a group of scientists, postdoc, and also student, technician, and collaborator working in many countries, as highlighted in different colors. in this map, and we have been very well supported by a series of donors listed here. We are very much thankful to them. And here's some of the major programs like One Health Center in Africa, but also capacity taking One Health in Eastern and Southern Africa, and also the One Health initiative of CGIA and many bilateral projects we are having. Okay, so let me bring you a little bit back to the context of research or intervention project we have been doing in Southeast Asia in particular. We come up first with the theory of change. So I believe that in this audience, you are familiar to that. We need to know where to go and what we want to achieve, what activities we want to introduce and conduct to achieve the objective and the outcome and the impact. And for example, here in the case of Cambodia, in our food safety project, Safe Food, Fair Food for Cambodia, also funded by USAID from Livestock System Innovation Lab. The purpose is really to reduce the burden of foodborne diseases, but actually we want to focus on a few areas that can lead to achievement of this objective. For example, we need to work with the researcher or different value chain actors, and also from the policy making with different ministries, and identify who are the stakeholders to target and what kind of activity we want to achieve through the capacity improvement, through the behavior change, or through the reinforcement of the policy of food safety. So actually, it's very important to have the theory of change to know where to work and where to achieve. Here, some result from a project we call Quick Risk, and we want to understand the risk actually in this phase, a pork value chain linked to food safety in Vietnam. So actually, we conducted risk assessment. We can approach from farm to fork, or farm to table, or from farm to chopsticks, because a lot of people eat chopstick in this area. A lot of sampling along the value chain to identify the level of contamination, both microbial contamination, but also chemical contamination, because public, actually people are worried about this pork contamination from both sides. Or another project, actually, here's a safe pork. You can see here, for example, it's very familiar and typical prevalence of Salmonella we see along the value chain here with samples in traditional model food services, pork value chain, and actually we see something like around 60% of samples were contaminated with Salmonella. It's quite high level of contamination we often observe in traditional market, and this actually we published in a few papers. You can have more information. So actually we bring ourselves from hazards concept, a hazards-based approach looking at Salmonella contamination, into the risk-based approach to understand, for example, how many people get sick from risk assessment. I think that Fernando mentioned it in previous talk as well. And here we came up with some risk result. About 17% of population in Vietnam would suffer from salmonellosis by eating pork. In this context, actually it varies a bit from different age groups, but that is average risk. And actually we look at it and we realize that the cross-contamination at the household level when people prepare food is one of the important factors that we need to control to mitigate the risk. We also estimated the economic cost that actually foodborne disease is causing for this country of 100 million now, 94 when we conducted a few years ago. And actually it costs something like around $107 per case. So when people were sick with salmonellosis. We apply similar approach in Cambodia, and here you can see from Safe Food, Fair Food Cambodia project, you can see something like 43% of Salmonella are contaminated in pork in traditional market. And we also estimated the cost of foodborne diseases. Here, foodborne diarrhea was about 63% per case. And if you know the total number of cases of foodborne diarrhea in Cambodia, so it gives you a picture of what economic loss we would suffer from this kind of country, for example. So that is actually a replication of study in Southeast Asia to really estimate the risk of people eating contaminated food, in particular foodborne diseases linked to pork in Southeast Asia. Okay, so we did this assessment. We know what happened, what is the level of contamination and risk, and it posed a question: how can you do to reduce this risk for people in Asia in particular? And actually, in RIF for the last 10 years, we developed the so-called light touch interventions, a simple intervention, or the three-leg stool as the name, because we consider and understand that the intervention should be a combination of different things. On actually, for example, on the right-hand side, you can see the technology and training. You need to work with people at the slaughterhouse level or the traditional market level to improve the hygiene practice, to improve the infrastructure of this level by training them, but also to work with them to invest some of the light materials, like, for example, the surface, how to wash, for providing water, and so on. So that we work a lot with vendors and slaughterhouse workers on that side. But actually, you need to go hand in hand with the so-called enabling environment. On the policy side, people have to support this change so that the actors have to comply with the intervention, and that we work with policymakers. Depending on the level you want to intervene, it can be from provincial level, commune level, or the manager of the market and slaughterhouse. So that is very important. And finally, incentive. If these people from the box number 1 and number 2 don't have incentive to do something to improve food safety, that would not be sustainable. And actually introduce some type of nudge to stimulate the chain of behavior of people. It can be financial. If the seller can sell more pork, they can have more money, or the politician or the political people can benefit from this chain to really push the agenda to improve food safety. So 3 things: technology, training, enabling environment policy, and incentive for behavior change. That is our approach. And here, for example, how we improve the hygiene practices in slaughterhouse in Vietnam. I show you the first photo that actually the slaughterhouse is very simple and unhygienic. And actually this need to be improved, because we don't want to see carcass handle on the ground, which the boot a lot of contamination. So we introduce this technology in consultation with the owner of the slaughterhouse, but also slaughterhouse worker and the community, to introduce the metal grid. Here you can see, it's about 20 centimeter high from the ground, and people can still slaughtering on the ground, which their habit, which has their practices, but it separates the carcass from the ground, and actually it might reduce the contamination of Totobacteria count and Salmonella in this environment. So here you can see a little bit extended pictures on how we train people, how we come up with the guidelines, how people slaughters in the context of Vietnam, for example. So simple, but efficient and accepted by the community. Or here, the case of Cambodia. And this time, the intervention was in the traditional market. You can see here on the right-hand side, on the left-hand side, the control case that people keep the practice of having the carton of paper and put the pork there, and actually no water to clean, no detergent to wash, etc. And on the right-hand side, here's the shop we introduced intervention, the 3-leg stool I mentioned before, with the size port and training certificate system, with the washing detergent, but also introduce also the surface with cheap material but easy to clean surface, and people wear apron and so on. And with that, it makes people change the knowledge, practices, and aptitude here on the left-hand side, but also reduce also the level of contamination. Like, and you can see here the actually the level of Totobacteria count and Salmonella here is really reduced by simple and low-cost intervention. For Cambodia, it brings from 53% prevalence of Salmonella to 34%, whereas for the same pork in Vietnam, from 52% to 24% before and after. And we think that with the investment of something like around $30 per shop, and with the training and with the effort of the market manager and animal health workers, we can bring the level of salmonella contamination in pork to a level that actually quite interesting and promising for scaling up this type of innovation. I mentioned before the three-leg stool approach is about policy also, and how we work with policy. So we documented here in this paper some of the experience how we work with policymakers, and I have to tell you that we are in the good time in the sense that the public and the population are very much concerned on food safety. And an USAID study showing that food safety is really important in Vietnam, even before education and the concern on the job. And we have a food safety law, and they introduce a risk-based approach to implementing this law, but the capacity to implement the risk-based approach was quite poor at that time. So we jump in, we train people, we train also people from the military, from university, from research institute working in food safety, and we work with the donor like the World Bank here, or as the convening power like FAO and WHO to come up with the analysis of food safety situation in Vietnam, in Cambodia, and we created the task force composed by scientists but also policymakers to really promote the use of this risk-based approach. And this is, I think that was an efficient way to really engage people to promote this approach. We also actually think of the future generation working on food safety. So we have developed capacity building program, working with university to develop curriculum to improve food safety and so on. And I think that is important to work here, for example, in Cambodia, but also equally apply for Laos and Vietnam for the work we did in the region. I think that is one or two more slides to show also that, if you want to convince policymakers to invest money in food safety intervention and so on, we need to show them the cost-benefit analysis in terms of money here we are talking about. And by coincidence, I'm sitting here in Uppsala University in Sweden for one of our PhD students talking right now about how to improve food safety in Vietnam through intervention. And my student Hai at the moment is showing in another room how we calculate the investment versus the benefit of food safety intervention, which approach from the slaughterhouse, from the wet market I showed before. And you can see here that food safety is really a social issue, because when you invest in that, it improves health and you can convert in dollar. But people don't see this dollar from food safety intervention. That's why we call for the investment from the bank, from the government, that don't see as the road investment or as a building investment. People can see that, but when you cost it out on this thing, that cost it will bring a lot of money for the society through food safety. So only this number can give a better idea on how useful the intervention would be in developing countries. I want to finish by saying that food safety is important. We celebrated the Food Safety Day, for example, here in the 3 days last week. We launched a new directions for food safety in informal market in developing countries report to celebrate this Food Safety Day. FAO also launched the WHO Global Strategy Food Safety, and also African Union also have a new food safety strategy for Africa. So the enabling environment is very interesting at the moment for those who work on food safety like us, and also the tripartite using the One Health concept, and they develop also the joint action plan for implementing One Health at global and local level, and food safety as an action track 4 is part of this strategy. So I think it is very important to see different movement and activities to promote food safety. And actually here the key message from my talk is really to tell you that food safety in traditional or informal market is important, because that provides a lot of jobs, food security, livelihood for people, but the level of contamination is quite high. So we need to do something to bring it down. And we agree that the risk-based approach is important. Moving from hazards to risk-based is important to really optimize the resource to do intervention on the point where food safety is an issue. The interventions we developed through Lex tool is interesting, low cost, but it can work in developing countries to solve certain level of food safety issue. And we need to do it with strengthening the capacity of different levels for this discussion, but also really engaging with policymakers through different models like the task force we are doing to create a good enabling environment to implement this intervention, assessment, and communication of food safety. So with that, I would like to thank you very much for the attention, but also to our colleagues who have contributed to this work and many donors who fund our work so that we can share with you today. So thank you very much. Back to you, organizers.
Thank you, Dr. Nguyen. We really appreciate that amazing overview of the work that's been conducted through ILRI. I certainly appreciate you also reminding us that pathogens are the leading cause of life loss annually globally, so pathogens like Salmonella. And so food safety is beyond, it's not just chemical hazards like aflatoxins, but pathogens are a major driving force. I also appreciate that you've highlighted that it's just, you can't just have risk assessment, you have to have management and you have to have communication in order for us to genuinely move the needle on improving food safety. So I would like to extend to our audience that you can contact the Food Safety Innovation Lab at the information that's posted on the screen at this point in time. We look forward to continuing the conversation on risk-based approaches to food safety. And if you're interested in risk-based approaches or have related research to share, we'd really like to hear from you to understand the country's value chains, market sectors, and where there's enthusiasm for this approach. So please feel free to reach out to the Food Safety Innovation Lab. I'd like to invite our panelists to turn on their videos and join us for a brief Q&A session pertaining to their work. But thank you again for being here. You're both very, very busy individuals and are really moving the needle on food safety around the world. So thanks for joining us today. If I might start with you, Dr. San Pedro, you walked us through a couple of examples of applying risk-based approaches. How long does it take to conduct a pilot study versus a full risk assessment? And what are the benefits of doing a pilot study?
Well, thank you again to the attendants for the questions. Actually, what I found is when countries start with this risk-based inspection implementation, the thing that they struggle the most is gathering the data from establishments. And it's actually surprising when I ask, okay, do you know what volume of production each establishment is manufacturing every year? And they don't have that data. And, so basically it's gathering the data and put it in a way that they can do further analysis in terms of volume of production, in terms of percentage of compliance with inspections. That's the other one. I've seen in, for example, Honduras, Guatemala, where they still have paper to conduct the inspections. And I'm sure, you will have same experiences in Southeast Asia, right? They carry paper, they have to go back to the office and transfer the results of the inspection into like an Excel. So gathering that data and then put it in a way that we can know what was the results of each inspection for each establishment, it takes time. So it's not right like applying the methodology, it's basically gathering all the data needed to fit the model and then starting to implement the risk-based inspection. The other thing that I think most of the countries struggle is how to identify the food categories. So, because food industry is very dynamic, every 5 years, you have hundreds of new products in the market that they will never be characterized or never be fully understood by the regulatory agency. So they need to keep up to date to these new products being in the market and how we're going to inspect them and what is really the food safety risks on those new products. So basically those will be the barriers or the bottleneck, for the implementation of risk-based inspection.
Sure, that reminds me of one of the many hats that I wear, but as we think about in the new food space, cellular agriculture or cell-based meats, that's a whole new category of foods. And where do we begin with that from a food safety aspect and questions and risk assessment? That's something we're certainly thinking about here at Purdue. Dr. Nguyen, if I might ask you a question, what are some of the external factors that may impact risk assessment prioritization in your experience?
Thank you for the question. I think that is important to say that, from our experience, we started this work maybe 10 years ago in Southeast Asia, and we face the issue of capacity in the country we have been working. Risk-based approach is not new for a high-income country, but I have to say that in low and middle-income countries, that is something that we need to strengthen more capacity. So when we started this work, of course, the purpose is really to engage with national partners, and at that time, the capacity was quite limited in some of the country we are working, and we are very happy to see actually a country taking up this approach, and also the capacity strengthened through different venues. For example, training PhD students, also organize workshop conference on risk-based approach, but also writing curriculum for university. So this kind of thing is important to strengthen the capacity. But I want to say also that at the end of the day, this approach needs to be absorbed and also practiced in one way to another by food safety authorities at different levels. And for that, the structure of food safety management varies from one country to another. But it's very important to really identify the key group of assessor and manager to be engaged and actually take this approach on board. So that is a bit our experience when we implement this research in that area.
Thank you. And if I can borrow 1 or 2 minutes of your time, I think there's a really important question, and I'd like to hear both of your perspectives, especially since you're working in different parts of the world on average. But we often hear that consumer willingness to pay is an obstacle to creating demand for safer food. With that in mind, can you share experiences from producers, processors, or the consumer side on paying for safer food? Or in the cost-benefit analysis, did you look at the health costs of foodborne illness the health costs of foodborne disease outbreaks to make the case for policymakers? So how do we talk about that this has a cost, and who bears the brunt of those costs?
I suppose that's the question. I can start first, and maybe Fernando can add from other region perspective. Actually, we conducted some study to see how different actors would willing to pay more to have food safety. And obviously, the demand is very much from consumer side. For the study in Vietnam, our study showing that people are willing to invest 20% more to pay the premium to get better food. So that is the data from interviews and this type of thing. Obviously, this option study we did need to be validated by the two studio. But really there's the willingness for people to have a safer food from consumer level, from a producer, and also from vendors level. Maybe that would be less clear, or maybe from the slaughterhouse owner, because they need to invest to achieve better food, but the incentive is less clear. Because in this type of context, either the food is safer, the pork is safer, or a little bit less safe in the market, you would sell for the same price. So our argument is, in fact, we need to go hand in hand with policymakers to have this enabling environment so that can make the difference between those who improve actually the food safety and others they don't. And that actually is the incentive to stimulate the change of people, both from production side and also from delivering and consumer side. So I think that is actually the only way to go forward, but not very much imposing only from the regulation, but really, combination of these three things I presented before in our three-leg stool. Yeah,
certainly. Fernando, is there anything you'd like to add to that perspective?
Yeah, I totally agree with Hung on that. Actually, I've seen, for example, in Honduras, making the case for longer shelf lives. So improving the whole hygiene of a food establishment will make your product have a lower microbial, load, and then, you can increase the shelf life. The other thing is opening up to new markets, right? So sometimes those, I've seen a lot of artisanal cheeses companies that they only sell in the village or in the town, saying, well, if you improve the conditions of your facility, if you invest in food safety, you can reach the capital, you can reach other big cities, which will increase profits, right? So that's the other reason maybe, for producers to jump into more food safety measures. And lastly, I've seen a lot of movement from producer associations, right? Like the National Dairy Association in the countries, like promoting that the facilities need to be registered and the regulatory agency and follow kind of the same standards. It's kind of a geographic indication, right? A geographic label saying this cheese is done in certain ways. That's why it has a different flavor, and we follow, So I've seen all of those incentives or campaigns in Latin America for that.
Well, I really appreciate you bringing up really the connection between food safety and food loss and waste. A lot of it is microbially driven, and there's certainly economic benefits if we can extend the shelf life of food, access to it through longer periods of time, certainly, but just keeping it available is such a big part of our long game solution to true food security. So thanks for bringing that up. I really appreciate it.
May I add something here? If you give me 30 seconds, I think that I forgot to mention one of the things you asked me about, the benefit, the cost benefit of different actors. And I just want to make the point that from our cost benefit analysis in our model, it shows clearly that, the net benefit come more for the consumer side. Because when the consumer has a safer food, so, they don't get sick, and all this money go to the consumer side, and the consumer don't realize that because of that. And the net benefit for seller is much smaller. That's why that represents also the challenge to put the producer and the sellers to improve food safety, because the net benefit come to them is very small, and people don't see the value of investment in terms of food safety improvement because less people sick, and that's go to the societal impact. You see, so the key message we want to call in our latest report launched a few days ago is, in fact, how to think strategically the investment for food safety through other programs. Because, for example, the donor and the government would invest much more on infrastructure and water and sanitation, WASH program, for example. But actually, if you can advocate this investment in combination with food safety, so you can realize actually certain objective and impact of food safety you want to change through other more popular programs that usually the donor and the government would invest because they see the change, better infrastructure, better bridge, better water, etc. But it happens also for food safety. So the equity or the distribution of benefit is not equal along the chain, but that actually makes sense to think about how to change the paradigm in food safety investment.
No, absolutely. It's got to be an integrated approach. Nobody complains if they aren't sick, right? It's not until we have disease and we see these systemic challenges that then we become aware. So while prevention is key, it's also hard to motivate when an incident isn't happening. So I certainly appreciate your perspective on that. But thank you, gentlemen, for joining us today. Some of the world's leading experts in food safety, risk-based approaches. Really appreciate that you took the time to showcase your work and hopefully demonstrate to a broader audience how these types of tools are really a fundamental launch point to making financial investments in food safety that are truly, truly high impact. So again, we thank you for joining us today. The link to the webinar and presentations will be shared by email, and the Food Safety Innovation Lab social information should be available to you in the chat. And again, thank you for joining us today, and have a great rest of the day. Take care.